morning, gentlemen. I'm here to communicate my feelings about the whole subject. I'm happy to be in this association where a holistic approach is being taken about the melodies of so-called sexual disorder.
Good.
Now, there are some institutions in India which proclaims ND, etc. And they are much more formal and much more structured. Entry is difficult, exit is also difficult. Here, the brilliance of the whole matter is this: entry is easy, exit is also easy. In between, whatever is being taught is a holistic approach. Our instructor or guide, Dr. Maheshwari, is taking cues from all the disciplines.
Take it. It's okay.
He is open to all the disciplines.
Comment.
Though he is a ND psychiatrist, he has not confined himself to that only. Sexual disorder per se, we know, is the domain of the psychiatrists. And they are very tight-lipped of the whole matter. They refer the case to a psychologist or psychoanalysis. We really don't know the outcome. But here, if I ask this doctor, he will tell you the outcome. In the morning, he told me the outcome. I was appalled by the whole matter. Now, in the land of Kama Sutra, we are learning sex from the Westerners. It's a sorry state of affairs. In our yesteryears, our forefathers in India, the Hindustan, the sexual knowledge was very much rampant. If you go to Khajuraho, if you go to your Konark temple, it came from the Kama Sutra. And there was no inhibition. Now, after the British invasion took place, the concept of sin was introduced. The whole structure was collapsed. Because in the Christian religion, the sin thing is very much important. In Hindu, there is nothing called sin. So Kama Sutra had its own bearing at the time. I was surprised when I went to Khajuraho to see the inscriptions. Oral sex, mutual masturbation, anal sex, everything was prevalent at that time.
Variations is a very
The variation.
neat.
Sex is mainly meant for two things: procreation, recreation. The procreation part is very important, and it has been officially more than established as a gynecology and obstetrics. The recreation part is vague. I am treating geriatric cases in armed forces, the ex-servicemen. The other day, a Mohammedan lady and her husband, a JWO from the Air Force, retired. They came, lovely couple. So they were having some problems about ED and PE. So I asked the lady one question. Madam, how many times you have been to gynecologist in the Indian Armed Forces Hospital? She told around 50 times. She had 3 kids, so due to labor problems, cesarean problems, one thing or the other, she had been so many times. I asked her, how many times the gynecologist asked you, were you sexually satisfied or not?
No.
She told no, not a single time. I use this technique to ask several other couples, of course with the husband present.
Okay. Anyway.
Otherwise it is dangerous.
Hmm?